And it shows that Walmart and McDonald's have the most workers that are on food stamp and Medicaid. So I guess, the Democrats are saying, hey, we're giving all these companies, paying for their employees' health care and food and everything, and because they're not paying a big enough raise or income or whatever. So that to me is an interesting point. Makes some sense here, right? Doesn't it? And here's the GAO's General Accounting Office. Now, here's that study. You want to see it. If you go to GAO.gov and put in Federal Social Safety Net Programs, okay? And look at they learn millions of American adults who earn low wages rely on federal programs to meet basic needs, such as Medicaid for health care and Supplemental Nutritional Assistance Program for food. That's SNAP, Supplemental Nutritional Assistance Program, SNAP. They used to call that food stamps. Okay, to learn more about these people who use these programs, we analyze employment data from 11 states and the census data. About 70% of the 70% of the people who get these programs work full time. 70%. The people get SNAP are working full time. 70% of the people who get Medicaid work full time. So the government's already paying for health care for people that have full-time jobs. Most work for private sector employers, like places like restaurants, department stores, and grocery stores, right? Okay, and again, that's probably mostly women, I think, that employed there because they're getting stuck now in the COVID. Nobody go to work and at these lower income jobs, and it's mostly work. Others work for, listen to this, state governments, public universities, and nonprofit organizations. Some employers in selected states had thousands of beneficiaries on their workforce payrolls. Whoop, my light fell down. Hate to have my light fell off. So you can see that whole report if you want to. But more importantly, okay, how do you find out where they are benefits for you? Because if you're not getting health there, well, check for Medicaid. How do you check that? I think a good place, because every state has different places. So the government has a website called benefits.gov, which is pretty good, for the kinds of things at least I'm interested in. Grants.gov is not as good to me. For benefits.gov is probably a better place, because grants, say like nutritional SNAP is not really a grant. It's just money, they call it, direct payment. They have all different names for it. So if you go to benefits.gov and look for SNAP, S-N-A-P, then you'll see, okay, you'll get a description of the program, who to contact, where to apply locally, and phone numbers to call if you need some more help, okay? Because again, all these programs are local. You have to apply locally. Okay, here's another, Medicaid. Okay, now that's Obamacare and all that kind of stuff. And you see a lot of people, and I did a story just the other day about how I think 40% of the people only pay who signed up for Obamacare only pay $10 a month. I mean, incredible, So you got to check it out, And a lot of people say, "Well, I make too much, I make too little." You don't know. You don't know until you apply. So go to benefits.gov, look for Medicaid, and that's really Obamacare. You could go to Obamacare, or no, they don't call it. They call it healthcare.gov, and find out. Don't forget, kids are free. Kids healthcare coverage. I think it's under 18. So if you have a child, make sure they get healthcare coverage, because that's a little easier to get really than grown-ups. Okay, so 70% of the people work full time who get these benefits. 70%. Wow, what a country! We already have socialism. What are you talking about? Worry about socialism. 70% get government benefits for working full time. Well, anyway, the world goes on, sorta.